PowerPoint presentation will highlight the requirements necessary for entrance into the Advanced Standing to the AAS program for LPNs. Admission to the nursing programs require a separate application in addition to the routine college application. There are several things that you must do to initiate this process after contacting Mrs. Terlizzi. We need to have your official high school transcripts or your GED sent into our office. In this way, she can review them to see if you meet the requirements for the algebra, chemistry, and biology. She will also require you to turn in your practical nursing program transcripts, a copy of your LPN license, and evidence of completion of an IV course or continuing education. You are okay to submit your LPN license that you can get on the Pennsylvania State Board of Nursing's website license verification. That is also considered a official document, and that is fine to submit. You must complete a minimum of 16 high school units, 4 in English, 3 in social studies, 2 in mathematics, with 1 of them required of algebra, and 2 units of science, 1 in chemistry and 1 in biology, both with a related laboratory. All applicants to the nursing program must have completed the high school requirements for algebra and their sciences, 1 being chemistry with a lab and 1 being biology with a laboratory. And it needs to have achievement of a C or better grade from these courses. Now, if you have not had those on your high school transcript, you can easily complete those by taking Math 052, Chemistry 107, and Biology 107 with a C or better grade. We will also review your transcript from your practical nurse program, because if you've taken anatomy and physiology or a biology course in that program, many times it will be equivalent to the Bio 107. Admissions will help you with evaluating that process. For the application process, now that you've decided to enter into our program, your contact person is Mrs. Deborah Terlizzi. She is the admissions coordinator for the Allied Health and Nursing programs. Her phone number and email contact are included for your convenience. Mrs. Terlizzi will then help you get scheduled for your Accuplacer Test. It's a computerized exam, and we want to use this exam to evaluate your results on reading, writing, and math. It is essential that students coming into the program meet at least the requirements of the college level. This will help in your success in the program. It is important to remember that we calculate your GPA, which must be at least a 2.5 when we are considering applicants for the Nursing Advanced Standing program. We only include credit courses that are required for the RN program. Courses that you will take prior to application to the program include the Biology 171 and 172. These have to be done within the past 10 years. If not, students will need to retake those as coursework. You will need to take general psychology, college writing, pharmacology, and microcomputer concepts to be eligible for admission. You will also need to have completed at least 1 year of acute care clinical practice, subacute care, or skilled nursing unit as a licensed practical nurse. That means you must have your license and be working for 1 year in these environments. If you have experience in a physician's office, if you have experience in home health or personal care, you will need to develop a plan to meet this 1 year of acute care clinical practice. Now you are ready to take the entrance examination to the nursing program. LPNs take 2 exams. The first being to measure your knowledge of foundations of nursing, and the second is the childbearing care of the child. This exam is administered at the W3Cs, and Mrs. Terlizzi will coordinate that with you. There are 2 times a year that we admit students to the Advanced Standing program. The first is the students who want to start in the fall semester in the daylight program here at Youngwood in Indiana, or the evening weekend program at the Greene County Center. You must apply by January 5th to be considered for this program. If you meet all the requirements and criteria, you will then be scheduled for the Nursing 200, which is the transition course, and Nursing 114, which is the physical assessment course, during the summer prior to the start of the fall semester. If you elect to do the evening weekend program here at Youngwood, you would have to apply by May 15th. And in the fall semester, you will take the Nursing 200 and the Nursing 114 courses so that you're ready to begin in the spring semester in that program. All candidates admitted to the nursing program will have to attend the mandatory group interview and information session. This is where I distribute to you the information on your physical assessment, examination, I should say, your immunizations that are required, background checks, and how to use the Certified Background website to upload all your material. There are certain deadlines for each of these requirements to be completed, and we do ask you to complete them. One of the biggest issues is not having them done in time, because we need to send your information to the clinical sites. Without it, they will not permit you to be on site. So you will have information on these dates and times. If for some reason you're not able to attend the interview, an information session, you will be asked to call my office prior to that date and schedule a meeting with me, and I will go over the requirements one-on-one. So there is opportunity then that you can, fulfill your commitment here. At the end of the orientation meeting, I will have your schedules ready for you, and we will get you scheduled for your transition course and the health and physical assessment course. Please remember, in the nursing program, the only people that schedule you for nursing courses is either myself or the nursing faculty advisor that you will be assigned to. There's a lot of paperwork that must occur with this, and this is why we handle this. We also ask that you listen and watch out for the emails on academic advising, because you will want to meet with your nursing and faculty advisor to make sure that you're on target to complete the program on time. Once you complete the Nursing 114 and the Nursing 200 course, you will be scheduled for your very first semester of the nursing program. Now, as you can see, the courses are listed as the first semester and second semester of the program. You are free and more than welcome to take microbiology, advanced composition, and complete your math elective prior to beginning the nursing courses. In this sequence of study, we have Nursing 225, which is OB and Pediatrics. Nursing 255 is care of the older person. Nursing 240 is Psychiatric Nursing. 260 is Chronic Care. 270 is Intensive Care. And 280 is the capstone. Any of the 5 prior classes, you can go and take those courses anytime throughout the year that you are in the program. We will schedule them based on which program you enter. The Nursing 280 is always the very last nursing course that you will take in your programming. This is where you learn to be a manager of care and take care of a cohort of students, make assignments, and evaluate care done by others. And this is really the progression. It's 2 semesters for you. Now, if you have more questions after reviewing this presentation, please feel free to contact either myself, Mrs. Irwin, or Mrs. Terlizzi. Again, I have our contact information here for you, and it's been a pleasure. Thank you.